Good afternoon. And today we have a special guest. Usually I interview physicians and patients and other practitioners, but today I interviewing somebody who is like my twin. I interview Dr. David Federici, who is very prominent dental sleep medicine physician. And he is diplomat of American Academy of Dental Sleep Medicine. And on top of it, he's also teaching in American Academy of Dental Sleep Medicine on a mastery program. And he's a board member of New Jersey Sleep Society, and he's a board member of a lot of different societies. So I'm so proud of to introduce you, Dr. Dave Federici. Good afternoon, doctor.
Good afternoon. Thanks for having me, Maria.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program is going to be for you, because we're actually going to talk about my specialty. We're going to talk about dental sleep medicine, what Dr. Federici is mentoring doctors on that topic, and he's going to give some tips and tricks how to make this therapy successful. And if you're a medical practitioner, especially if you're a dentist who is dreaming about dental sleep medicine, this interview is going to be for you. I suggest you to listen to that maybe several times, because we're going to talk about internal gains, how to make this practice successful. Not only if you devote it to your patients, how to make this business successful, because it's not only treating the patients, how to work with the medical, with the physicians, how to work with the medical billing, how to market your practice, what people would find you. We're going to talk all about that. And as usual, I want to introduce, from me, how I know Dr. Federici. So first of all, I heard about him from his students of the mastery program, who are in our audience as well. And they mentioned to me what they took that course, and they flying from Singapore or Australia to listen or to learn from Dr. Federici. And they said, it's every cent of my long trip and being on a plane for that many hours really worth it, of the knowledge I got from Dr. Federici. So we are very lucky to interview you so close. And then I met Dr. Federici on Philadelphia Sleep Conference last year, and I listened to his lecture, and it was great. A lot of insights. But then, we communicate a little bit. But what's so special about Dr. Federici, what he came this year, wake up so early to support me when I lecture. So in addition to such a perfect human qualities, he is, as I said, diplomat of American Academy of Dental Sleep Medicine, and he is a faculty of the mastery education, and then he's a chair of American Academy of Dental Sleep Medicine Task Force, and board member of New Jersey Sleep Society. And his interview recently was published in Journal of Dental Sleep Medicine. He has a wonderful wife of 33 years, and he has a lot of interest, but he's also running very successful dental and dental sleep medicine practice. So we'll find out how it's all happened. But I'm going to start with your teaching part of your life, how I personally find out about you in the beginning. So this program, a lot of people who wants to practice this unique specialty we do, they ask me, what courses should I take? Is it important to be the diplomat, or I can just, take impression to the appliance and call it a day? Is it worth it time and investment? And after the course, would I be able to start practicing my skills?
Well, wonderful. Thank you so much for that kind introduction. And you're right. The education is what we should all strive for. And this particular situation or condition, obstructive sleep apnea, is very damaging to one's health and can actually lead to stroke and AFib and dying in your sleep. So a minimal amount of education in this particular area is not what we're looking for. It's not what our referring physicians are looking for, because they're entrusting their patients to us to treat them, and they're kind of on the hook because they're writing us a script for us to initiate therapy. So I always tell dentists to, like you said, take these weekend courses, use those as a guide to see if you're willing to take on what the enormity of treating sleep apnea is. Not to go back in a couple days after a couple hour courses or a couple day courses thinking you can treat this condition, right? Use that to realize and learn about the enormity of what's involved in treating it, and then commit yourself to the highest level of education you can so that you can not only treat your family, friends, and your own patients to the highest standards, but also your referring physicians to the highest standards.
No, it's a wonderful answer, but I want to become a very practical person. And I understand for a lot of dentists who see, we have a quarter of population who suffer from obstructive sleep apnea, and 33% who suffer from sleep disorder, maybe upper airway resistance syndrome. So we as a dentist, we see those signs in our eyes every single day. But I think it's such a challenge to start the practice. So what's your internal process? What are the steps? How you convince the patient who came to have a feeling change on tooth number 12 and 13 from obstructions, or who has a vertical fracture from bruxism, to get into the right comprehensive direction and learn about maybe they do have obstructive sleep apnea. So what's your process? What are the steps?
Yeah, so you can use an emergency or an infraction or overall bruxism signs and symptoms a patient has to build your case for the relationship between undiagnosed obstructive sleep apnea and their condition. But we have a questionnaire that's very involved that lets the patient give information up to their habits and their sleep. And we also have a chairside screener that we do the Malampati, and we ask about nocturia and BMI and snoring and tonsils and things of that nature, so that the combination of the self-administered answers for the patient saying, yeah, I am tired. I do get up to go to the bathroom at night several times a night. I do have GERD. I do have a refractory hypertension. Why are you asking all these questions? And then you combine it with the anatomical screening chairside. And then you combine it with maybe, like you said, that abfraction or broken tooth. We have this connection between undiagnosed sleep apnea and the bruxism, which could be an indication, combined with the physical characteristics, combined with your self-filled out questionnaire, is leading us down the path that we should get you screened and tested. And that's how we do it in our practice for every existing patient and for every new patient. Of course, we've gone through, with all my years, all of our existing patients are screened. So we're only seeing the new patients with that. But majority of my cases are referred cases. So it's not the same with me as opposed to somebody new who's getting into the field. They have to go through their whole patient population this way first before they work on the collaboration network.
I think it's a very clear answer. So to give an overview of your answer, the questionnaire would be the beginning of a conversation, and its support with the physical exams and evidence of these two sources from patients himself, leading to next step, which probably involve sleep study.
Correct.
And then, and I think it's what I want to say to the dentists who listen to our program. It's not going to happen like that. It might be the questionnaire, and it might be physical exam, and it might be your conversation. And those knowledge might be stored in some areas of your patient head. What I think very important, but if you see a patient every 3 months or every 6 months, you get back to this little, a little secret drawer and say, you remember, we discussed. But emergency usually can unlock that box and say.
Excellent point, because we've had patients on the third recall say, you know what, I was thinking about more what you said about, and I am snoring more. I think I want to follow through with the sleep study. So some people have that protective reflex that they don't want to go down another path of another medical condition. Exactly. Or I'll think about it. And that's okay. You're planting the seed. But guess what? Every time they snore and they get elbowed, our discussion is going to pop up in their brain. And this is going to reinforce what we said. And again, your own patients are very trusting of you. I've been doing this for 33 years. If I tell somebody something, they're going to believe me. But, if you're a new patient coming to a new practice, they're going to get a feel out for this person. Are they trying to push me into something I'm not ready for? So you have to, attack each patient at a different angle. A new patient's more welcoming. Hey, you have a broken tooth. Let's think about this. A patient who's been there for 20 years, or you've seen gain weight or had some surgeries, or there's changes in their medical history that pops out. You know what? I'm concerned. Let's think about doing this. And again, each patient has to be approached that differently.
Absolutely. And I like those words, I'm concerned. I think it's a very great trust builder. A lot of things are in vocabulary.
True.
And this is a very nice phrase. So I would like to ask you, you are a role model of building dental sleep practice. So what strategy help you to grow your referral network and your patient base for dental sleep practice? I want, if you don't mind, tell us about the mistakes you did and about steps what lead you to something valuable.
Yeah. Sometimes you follow a path you think is going to be successful, say a particular social media marketing plan that doesn't end up working. And then you might one day go to your local hospital where they have health fairs, and you put up a table, and all of a sudden you get 10 new patients and you meet 6 doctors who see what you do personally. And it's that silly little health fair or that mall health fair that you put a table up that blossoms. It's an unknown sometimes quantity that comes in. Right. So just take advantage of senior developments. Sometimes they're looking for people to come in and speak, and where you get your name and you get exposure and you get a chance to speak to the general public. We're always talking about speaking with referring physicians and collaborations, but sometimes the general public needs to hear about oral appliances because it's not the topic of choice for sleep physicians and pulmonologists, right? And little by little, more and more exposure. Hey, I saw you at the health fair, or I saw you at the mall, or I saw you at the hospital, or I saw you do this. And it's just, you get more familiar, and then word gets around to doctors and primary care physicians. And before you know it, you're getting in front of them to talk. And hopefully you build up your confidence, and you've gone through cases where then you can have those one-on-ones with them, as opposed to just to the direct-to-consumer discussions, if that makes sense.
No, I think it's a great advice. Like, for example, I was very surprised myself. It happened 3 weeks ago. I got a phone call in the office, and somebody named Chris said to me, I know you. You came to train us when I used to be the sleep technician. And it was maybe 15 years ago. Wow. He remembered me, and now he became a nurse practitioner. So now he has a freedom to refer. And just so many years, we have not been in touch. And I thought, my God, it's so special.
Yes, that's excellent. You're right. You're just setting yourself up and saying hellos and handing out cards. And it's amazing. Like you said, it may not be instant, but these seeds planted everywhere, then the grass will grow from all around. And that's the beauty of this profession.
Yeah. I think it's so important also raising a medical practitioners. Like, I know you do a lot of education towards the physician around you, maybe younger sleep physicians, they're going to be more receptive to the ideas.
You're right. A lot of the, people who are in the last 5 to 10 years of their career are kind of set in their ways, and, don't expect to go in there and change their minds, right? You talk about the young fellows, and of course, that's a ever decreasing population now. The fellowships can't even get filled in sleep. So we focus a lot on physician assistants and nurse practitioners because they are young. They envision themselves as, hey, I'm 29 years old. Would I want to wear a CPAP machine? I'm in the dating scene right now. A 70-year-old guy who's in the last 5 years may say, hey, just wear it because that's the gold standard. It's what I was trained on. And they don't think about it as a younger population. So that's why I like to gravitate more toward nurses and physician assistants. They seem to have a more youthful look at oral appliance therapy. They're more embracing of it and giving their patients options. And a lot of the patients really enjoy talking to the nurse practitioners and physician assistants because they spend more time with them. Yeah, the doctor's like 3 minutes, bang, he's out. It's my way, in black and white. Whereas they open up a little bit more to the nurse practitioners and the PAs. And that's very refreshing in this industry right now for us.
I love, this is a great points of strategy. Now I'm going to talk about a very controversial point. We all want to help our patients. Any dentist want to, help the patients, of course. And a lot of dentists think about dental sleep medicine, but there is, besides collaborative process, which we're going to talk a little bit later, also medical billing. Dental billing, we did the procedure, we put it in a computer, and boom, claim is out. But how to build that system, because everything is in a system, how you build the system of medical billing, because it's also very important for health. Somebody have to be happy with the therapy and financially comfortable. Because if you're financially uncomfortable, none of the therapy, you're going to just think about, oh my God, no, I don't want it. I cannot take another burden. So what's the billing process in your practice? And what are the key things to know when submitting for oral appliance therapy to medical insurance? What mistakes you see and what the right process?
Sequencing, sure. Well, it's the biggest roadblock. Let's be honest. I wouldn't say it's a controversy, more of a difficulty. Many dentists think that they can somehow, going on Google and filling out how to fill out a medical form, or they can print out a receipt, give it to the patient, and hope they can get reimbursed. And then the single most important thing for me from day one is signing on and doing my research on medical billing companies to handle, and they give you a template of what forms are needed, how to fill things out. You send it over to them. They will do the benefit checks. They will do the pre-authorizations, and they'll do the claim status filings for you. So the only common sense way to have an in-house biller would be if you're doing so many cases that you save money by not giving a percentage away to a medical billing company. But as far as getting started, do not try to attempt it yourself. You'll have so many roadblocks. You won't know what forms to do, and you'll get frustrated. And you might have been a great dental sleep medicine provider, but this stupid little sequence of medical billing discouraged you, right? And you fall off. So this is the number one hurdle that causes most dentists to give up, because they can't figure it out. Now, some people choose to go fee for service and say, you know what, my dental practice, I'm not dealing with any insurance and Medicare, and they want to maybe just market themselves that I am cash only. Then by all means, that's your prerogative. But what I always teach dentists, you have to read the area around you. If there are other diplomates who have the same educational level, but they are participating with an insurance network, or they are participating with Medicare, then if you're on equal standing educationally, why would I go to somebody and pay the full price versus going to somebody in network? So just like your competition in your dental contracts, you have to read the area and see what your competition is. Do you have to join a network? Because if you don't, you're not going to get any Blue Cross Blue Shield or Delta Dental or whatever it may be kind of patients, because there are the dentists in your area who are in network. So your surrounding areas dictate your level of education you're going to need to compete, as well as your participation in insurance and Medicare as well.
So basically, just to review for the listeners, when patients come in, you gather all the information you need as a provider, and your staff send it to medical billing company. Get insurance verification, because I think in this game you need to inform the patients what would be the contribution. And God bless people who only fee for service. I love them. I support them with all my heart. But I want to help the patients. I think it's very important to maximize the insurance coverage, because insurance is expensive game as well. And after that, we send it to medical billing company and we get the benefits as detailed as possible. Is that the same way for you?
Yes. And they'll let you know if you need a certification, authorization, in-network, out-of-network exceptions, all that will be given to you. And then you know exactly what to do and how to do it. And again, getting that hurdle out of the way. Obviously, at some point, it's good if you're going to do more and more sleep is to have somebody specific role to be the sleep coordinator or sleep champion, who is not, a different assistant each week doing, I don't remember who did that. I didn't do that one. That person was responsible. So you have to kind of focus it down, that if you're just going to do a couple here, a couple there, anybody can do it. But if your goal is to do more and more dental sleep medicine, you want to have defined days, defined hours, defined staff. So you're organized and you're kind of focused, and you don't have this employee to employee variability, which leads to a little bit of chaos.
Absolutely. It's such a great term because I interviewed Jason Tierney on my channel and I like the term sleep champion. I have a team of medical sleep champions in my office who handle that. And I think it's very important because dental setup, very different from medical, and people who call from the medical offices, they have a totally different idea. That's why I don't like to mix it so much. And
Exactly.
I want people who focus on it to handle it. But then I want to talk about another very big roadblock for this area. It's called collaboration. And you and me, we're trying to be the, play the role in the field to make more dentists to be, dental sleep medicine provider. And even for us, even though we have a confidence to talk to physician and other specialists, it's still not easy. I want my audience to know that people who trying to get into the field, like, tell me, is it easier for you? Is it successful all the time for you? Like we try to present the talk for American Academy of Sleep Medicine. So challenging, right? So tell me, what collaborative approach you have success with? I know you collaborate a lot with the sleep physicians. I'm talking about now the cases, because things what you do amazing, like you collaborate with Inspire treatment, you collaborate with a weight loss specialist, and it's obviously bring such a great outcome to your patients, because not one thing, it's more than one thing. So share the strategies of this collaborative approach, including your combination therapy.
Right. Well, these conditions overlap between specialties. So besides obviously going one-on-one to tell them, these doctors, what we do, it's great to see some of the dental sleep medicine meetings out there, like our annual meeting, AADSM meeting in Las Vegas, has many doctors attending. We went to the AAO, which is the American Academy of Otolaryngology meeting down in Orlando, and there was several discussions on oral appliance therapy. I think today's consumer is empowered with more information. They're seeing the Inspires, that there's alternatives to CPAP. They're seeing the Zepbounds and the Manjaros and the Ozempics as weight loss. To, hey, now I'm a candidate. Before I was too severe, you told me, just like I was too severe to get Inspire. Maybe we do the combination of losing weight, and now you might feel more comfortable sending me your mild or moderate patient with obstructive sleep apnea, because their severity level is decreased to a comfort level to refer them to oral appliance now. And I've had some patients say, hey, if you work with me on losing weight, I will get you to Dr. Federici. But right now, with your severity, I can't get you out of the CPAP because I'm kind of on the hook medically, legally for that. And if you can work with me in losing that weight, and we can do another study and see you're now into the mild or moderate range, then I'd be more than happy to get you into an oral appliance if you're willing to get out or wanting to get out of the CPAP machine. So I think working with ENTs on Inspire, again, sometimes just like the pressure of CPAP is intolerance for some patients, sometimes the level of amperage for the Inspire is too electrical in nature and they have to lower it down. And the combination therapy of oral appliance doing 50% of the work and the Inspire doing the other 50% of the work is a way to work together. So we all need to work together and collaborate, because sometimes each therapy by itself is not enough. But only in combination, whether it's the upcoming medications coming out that are going to be helpful, and then the GLPs like we talked about, and supplemental oxygen I'm doing a big study on for high loop gain patients, and being able to talk and discuss with other physicians to know that, hey, it's just my form of therapy or the highway isn't going to work anymore, because patients are more researching the different options out there. They're aware with marketing. So they're coming in more empowered to their doctors saying, you know what, my sister-in-law has an oral appliance and she was moderate or severe and it worked for her. So these dentists or doctors are more on the alert now that the customers coming to them are more informed, and they have to have that collaboration attitude to make this work for their patients.
Yeah, no, number one, I really support what you came on my collaborative lecture. So now, I got inspired by a lot of things what we had in a conversation, and I included in the lecture. So you made a big influence on me. But another thing what I want to mention to any patients who listen to our conversation, yesterday I was super lucky in my practice. I met first New Jersey patient with Remedy. Remedy is a central sleep apnea electrical stimulator what goes under the skin, doesn't have a remote control, and goes to phrenic nerve to move the diaphragm. And it was like I learned so much from that case because for him, that apparatus stopped working after 3 years. Because, it's still a process, it's a new device, and he wants to control his sleep apnea. And immediately his sleep doctor sent him for Inspire. And when he opened his mouth, I usually I don't comment what, okay, it's great. He said, I don't want the surgery, but I look at his mouth and his tongue, the size of his tongue was enormous. And the vertical dimension or space between the jaw was very minimal. So for this monster to get Inspire, it's not gonna open anything because that size is just so big. It like need to be brought maybe half of a meter outside of the mouth. So in his case, oral appliance would be the first choice before the Inspire, because most likely Inspire alone would not bring the monster out. But his physician never looked in the mouth.
Yeah.
And so that was a story what I learned so much, and I really appreciate a lot of your insights, doctor, and I hope our audience can find you on a LinkedIn, and you have a wonderful website for people who want to get to your professional help. And people who want to learn from you, they have to go DSM Mastery Program, and they can become very successful just like you.
Thank you so much. Appreciate it.